Okay, talking about wait and see for more information. Man, we should just stop calling them conspiracy theories and start calling them spoiler alerts. Because a lot of stuff that 3 months ago, 6 months ago, a year ago, 18 months ago, people, and I don't care what people they were, on the left, on the right, at the ACLU, libertarians, social justice warriors, doesn't matter. A lot of things that people were saying might be concerning or might be counterfactual to the accepted narrative on COVID-19. They were banned from social media. Their posts were censored. They were called conspiracy theorists. They were, kind of laughed off of certain or banned off of certain social media platforms. And the reality is you can go all the way back to our first podcast. And I think this was it. Chris, maybe you can look this up. When Cole Strange was on, he talked about the mathematics of the swine flu. I think that was the H1N1. And he said, look, I don't know what's going on in COVID. I think we filmed that. Jesus, was it like almost a year ago now? About 8 months, something like that. It's been a while.
I think in January.
Yeah, I think in January. So this is 8 months ago. This is our friend Cole Strange, who's a very educated and smart guy, but not a doctor. And he just said like, hey, there's probably a wait and see metric here because, with the amount of testing we're doing and the amount of fear that's being pumped into the system, at the end of the day, if we went back, however many years that was, 5-9 years when swine flu was a thing, when you look at the CDC data, something like 50 million or 70 million people across the country were at one time or another projected to have had swine flu. And if we were doing the same type of testing back then that we were now, the numbers would have been really scary because you would see a lot of people who died with swine flu, not necessarily from swine flu. And if you were testing every single person who was coming into the hospital for swine flu, you would be like, oh my God, cases are through the roof. And so a lot of people were saying, hey, this is concerning how they're testing, right? This is concerning how they're paying hospitals, depending on what study you read and how you interpret the government documents. It's concerning that the government is paying hospitals between $25,000 to $35,000, sometimes in excess of $50,000 to treat a COVID patient, right? Like this kind of sets a moral hazard where do the hospitals have a motivation in sourcing more COVID positive cases in order to make more money? And kudos to The Atlantic. I read The Atlantic frequently. Shout out to my buddy Joe, who gifted me a subscription when he thought I was reading only right-wing publications. I like The Atlantic. I think a lot of their stuff is very left-leaning. I think their editorial section is almost complete propaganda, but they do a lot of really good research, and kudos to them for this article that just came out. We'll link to it in the comment section below, or the liner notes. Liner notes. I'm showing my age reading like album and cassette tape liner notes. The Atlantic says the headline is, our most reliable pandemic number is losing meaning. A new study suggests that almost half of those hospitalized with COVID-19 have mild or asymptomatic cases. Okay. So if you remember correctly, when COVID started, all they could talk about is the deaths. Okay. And thankfully, although this is a real disease, it's very scary. People are dying of it. Once they stopped sending old people with COVID back to nursing homes, once they got a grip on the fact that like, okay, if you're under 50, you're pretty safe. If you're under 25, you're like 99.999% safe. Once they got a grasp on the fact of like, hey, we probably shouldn't intubate as soon as we are. This really dramatically, when we talk about severe COVID, like long haul COVID, which that hasn't even really been defined yet, or most importantly, death from COVID, it really affects elderly people. All right, we got to protect the elderly. We got to shelter the elderly. We can't send sick people back to nursing homes. We got to lock down. We got to do COVID testing. We got to make sure that, we have a preference of putting social workers and healthcare workers that had already had COVID in the population to treat the older people, because then they have a natural immunity. They'll be less likely to pass COVID on to these elderly people, right? So all this stuff was taken care of. Well, then they started shifting away from the data points of the deaths, and then they started shifting towards the data points of the infections, right? The number of cases. And the problem is the number of cases doesn't really tell the real story, because if 200 million people get the flu, but only a very small percentage die from that or have long-term severe symptoms that are lasting, then, hey, this is kind of just a normal disease that goes through the population. And thankfully, it doesn't have a huge death rate. Influenza does not have a huge death rate for people that are infected. And even people that get severely infected, there's treatment protocol and there's things that we can do and rest and fluids and all that kind of fun stuff and take 2 Tylenol and see me in the morning. Most people get over the flu. Well, the problem is that when you scare everybody and now every hospital goes into massive testing mode, you can further exacerbate the problem by telling everybody how many cases there are, when what this article is pointing out and what the study is pointing out is that they did a study of a couple of VA hospitals. And they looked over 50,000 individual cases of people that tested positive for COVID. And then they looked at, okay, why were they admitted for COVID? Did they have a oxygen saturation rate above or below 94%? Because above 94%, you're fine. You basically have a cold or you have no symptoms at all. And below 94%, then you have severe COVID or you have actual respiratory problems, and there's chance of all kinds of things, including like congestive heart failure. And if your oxygen level gets too low, you're really fucked up. That's bad stuff. And so what they did was this new study looked at these VA hospitals, and from, let me find the data here so I don't get called a liar. They looked at 50,000 cases. I do know that for sure. Okay, so the study found that from January of 2020, okay, wait, I want to make sure I get this right. Okay, so from March of 2020 to January of 2021, so basically pre-vaccine and pre-Delta virus, they found that the percentage of people that went into the hospital out of this 50,000 who went into the hospital, but maybe they went to the hospital because they broke their leg or because they had to have, kidney dialysis or because they had to have eye surgery. Well, everybody, if you remember, and if you've been to the hospital in the last 18 months, everybody immediately gets tested for COVID. And so not surprisingly, they were having all these positive COVID tests. And there's even been some people that created the PCR or PR. Is it PRC or PCR? I think it's PCR. PCR?
PCR.
Yeah, PCR. The PCR test actually gives a fair amount of false negatives, and somehow you can spin up the minimum amount of disease that is in the blood cell and make it come back as a positive. I'm not saying that's any type of conspiracy. I'm just saying that the test is not foolproof. So anyhow, pre-Delta and pre-vaccine, 36% of patients that came in and tested positive for COVID either showed no symptoms, had mild symptoms, or were there for something completely outside of COVID-related issues and just happened to test positive, right? I know my sister gave birth to my second nephew, which is awesome. And she went into the hospital feeling fine, just like for a normal checkup. And she had something going on with her internal lady parts. And they're like, well, since you're here, we got to give you a COVID test just in case you have to admit you. And it came back positive, but she wasn't coughing. She wasn't having any complications with the pregnancy based on the COVID. Thank God. She didn't even know she had it, but now she goes into this pool of positive COVID tests, which then get reported by the media. Now, even more good news. After we basically start to get massive vaccinations at the end of last year, a huge cross-section of the population is now immunized from having natural occurring antibodies from getting the disease. And the Delta variant is coming out at the same time. So now we have like a whole new level of infection, which should scare us. 48% from January of this year, 2021, till June of this year, 48% of people who tested positive for COVID, when these doctors actually went through and looked at each individual case and studied the digital medical records, they were not submitted to the hospital for COVID. They didn't have major symptoms for COVID. Their saturation rate wasn't below 94%. So all I'm saying is that the media thrives on this fear porn, right? And this is actually a good lesson for us in why central planning is never as good as the market. And this could get into a whole communism, central planning, socialism. It doesn't work. But I'm just going to give you this thought experiment. So here's the thought experiment, or here's the facts, and you can create your own thought experiment. I think with the CARES Act, the big, $1 trillion bill that was passed to help COVID relief, I think when they passed that, somebody with good intentions looked at the hospitals and said, hey, if the hospitals are overwhelmed treating COVID, then we know that they can't do elective surgeries, They can't do the high cost procedures. They basically can't do all the things that makes a hospital profitable and stay in business. So I'm sure some very well-intentioned politician, I don't care if they were a Republican or a Democrat, doesn't matter, put something into the CARES Act that said, well, for each COVID patient that you test, you're going to get $25,000 or $35,000, or if it's like a Medicare supplement, something $50,000 to treat COVID patients. Because the thought is, if they've got COVID and they're on a respirator and they're in the ICU for 21 days, then that's a real concern, right? That's huge amounts of money that the hospital and resources. And then if everybody's scared of coming to the hospital because it's overrun with COVID, or you can't do elective surgeries that are very profitable for the hospitals, the politicians were thinking like, we're smarter than everybody. We're not going to think of second, third, and fourth order effects. So we're going to give these hospitals $25,000 or $35,000 per COVID case that they treat. Okay, well, now you give somebody a financial incentive, right? And now they're going to test everybody that walks in the hospital, whether they show symptoms or not, maybe because that's good public health medicine, or maybe because they want the test to come back positive so they can say they treated a COVID patient and get the extra $25,000, $35,000, $50,000, right? So now, because central planning tried to do something and didn't think of the second, third, fourth order effects, and, if the market was responding to this, maybe they don't test everybody unless you have symptoms. But what ends up happening through testing everybody, for example, from January this year to June of this year, you get 48% of people testing positive who either are completely asymptomatic, don't even know they have COVID, or they have such minor symptoms, they're probably there for something else. They fell and cut their head, and then they say, well, we got to give you a COVID test, and then it comes back positive, and then now you have a COVID treatment protocol, right? And what I'm trying to say is, one, this is good news. This is really good news that almost 50% of the people that have been reported as like COVID cases, COVID hospitalizations, they're not actually there because they're dying of COVID, or that they even have serious symptoms of COVID, which is good news. By the way, this is good news. This is stuff we want to talk about. Number two is, this is just a good reminder that like central planning, communism, socialism, a group of 535 people in Washington think they're smarter than the entire free market of 350 million people. There's always these second and third order effects, because guess what? Now that we have all this reporting of all these COVID hospitalizations, it's even scaring more people into not going to the hospital. And it's even causing more hospitals to not be able to do the profitable elective surgeries and keep the doors open. And then this, this vicious cycle just continues. Sadly, I won't say who it is, but Chris and I have a very close friend who's a fire captain. And I was talking to him a couple of months ago, and I was like, hey man, because I don't know, like I have my opinions on COVID. I have my opinions on the vaccine, but I like to hear from people that are like on the front lines. I have a friend who's a nurse at USC County Hospital. She's on the front line. She's been working in the COVID ward before they shut it down, like the supplementary overflow COVID ward, which they shut down. Good news, because they're not overwhelmed. All the ICU beds are not filled. And I asked my friend who's the fire captain, I'm like, hey man, you were a paramedic, you're kind of running calls, you fill out all the paperwork. Are you just like transporting people that are on their deathbed with COVID back and forth to the hospital? Like, is everybody dying of COVID in your area? Because he actually works in a Asian community that skews much older than the general population in Los Angeles. And he said, no, he's like, tragically, the people that we're having emergency paramedic situations for is people that are sick and they know it. Either they're having chest pains, or they're supposed to be on kidney dialysis, or they're supposed to be getting their chemotherapy. And they're so freaked out to go to the hospital because of all this news coming out of hospitals being overwhelmed and cases over the board and hospitalizations over the board, out of control. And he said, what happens is these people that know they need to get their dialysis are so scared to go to the hospital because they think they're going to get COVID and die, that they don't get their dialysis. And then it's not until they pass out and the family can take over, because the person no longer effectively can make their own medical decisions, that the family calls 911 and says, hey, we need to rush my family member to Kaiser because they haven't had their dialysis in 17 days. And so they're trying to get kind of like some public information out there, like, hey people, COVID might kill you. Not getting your kidney dialysis will kill you. And so, it's just, shame on the media for the fear porn. Shame on the government for thinking they can solve every problem. And then just shame on everybody for cherry picking the most scary fear porn stat when it comes to COVID. Because all you're doing is you're muddying the waters. And this secondary headline that was in here, I thought was really great. And again, kudos to The Atlantic for doing some real hardcore reporting here. it says, this links to another article which I read that says America's entire understanding of the pandemic was shaped by messy data, right? Well, no shit, Atlantic. You were part of the problem because you kept pushing out the messy data to get as many clicks as possible because you wanted to scare the shit out of people. And so, look, get the vaccine, don't get the vaccine. If you're old or you're in like a group of people where, you have many comorbidities, you have diabetes, you have respiratory issues, you have heart issues, you're morbidly obese, you're over whatever the age is these days where most people are passing away from COVID, over 60, 65, 70, 75. Do everything you have to do to protect yourself. Talk to your primary physician about the vaccine. That should be your decision between you and your doctor, right? Do everything you can to protect yourself. And if you're generally healthy, look into articles like this. Look into the actual data. Look into how scary this disease actually is. Or maybe you'll find how scary this disease actually isn't. And I highly recommend that you do what you can to live your life, take care of your family, take care of your health, and just turn off Fox News and MSNBC. Please listen to us. We'll try to bring you underlying facts.